The Senate Health, Education, Labor, and Pensions Committee will please come to order. Dr. Schwartz, Mr. Kaufman, thank you both for appearing before the committee and for your willingness to serve. A lot of this conversation for me is going to revolve around vaccines. Why? Vaccines should be settled. But right now there's a lot of flurry of misinformation when it comes to immunizations. So that matters a lot to me. When I attended LSU, I drove a professor to work every day, quadriplegic from polio. If the polio vaccine had been available, Dr. Keister would have lived a life ambulatory like everyone else. But as it was, his whole life was every night sleeping with something to help him breathe. A routine, inexpensive vaccine, which was not available, had it been available, would have altered his life wonderfully. I've told the story before of an 18-year-old patient I had as a physician with acute hepatitis B, 18 years old, having to send her off for a liver transplant when a $50 vaccine would have prevented that. There is misinformation all over the place, including that hepatitis B vaccine can cause autism and things like that. It is absurd and is undermining trust. And if part of what we're trying to do is reestablish trust in public health, you have to wonder why people would spread that misinformation. So, why don't we have trust? Well, they didn't trust it under President Biden. They don't trust it under President Trump. They don't trust it under Secretary Kennedy. So I can't say we can point a finger at any one thing, but I will say the agencies you seek to lead are integral to the United States public health and medical preparedness and response capabilities. To do your jobs, you will need buy-in from the American people. According to a recent study, the percentage of U.S. adults reporting high confidence in the Centers for Disease Control and Prevention fell from 82% in February 2020 to 56% in June 2022, along with decreasing trust in other U.S. health institutions. Mr. Kaufman and Dr. Schwartz, you're both smart, you're experienced, you will have the opportunity and the responsibility, if you get these jobs, to rebuild public trust. The U.S. needs to be ready for the next emergency. The Ebola outbreak in Africa is spreading far more widely than people thought it would, and they're not quite sure how it is. My staff here wrote cyclosporiosis, but I think it's cryptosporidiosis, which is causing outbreaks throughout the country. I don't know who's right, but it's something that starts with a C and ends with an SIS. And if you get it, tie yourself to a toilet for the next, whatever. But that is a public health issue which is obviously impacting us. We need smarter strategies, and we need better investment with the limited resources we have, whether it's CDC, BARDA, the Strategic National Stockpile, or ASPR's industrial-based programs. Again, how do we get to where public trust is broken down? Clearly, mistakes were made during COVID-19. Under the Biden administration, CDC failed to communicate crucial information and allowed outside political groups like teachers' unions to influence whether schools were safe to be open as opposed to relying on scientific data. ASPR is less well known to the public, but plays a key logistical role in ensuring that responders have the supplies they need and when they need them. In addition to deploying products and supporting U.S. manufacturing, ASPR coordinates the federal medical response and supports the development of life-saving tests, treatments, and vaccines. ASPR played a leading role in Operation Warp Speed, demonstrating what can be accomplished when government works quickly and effectively with the private sector. Importantly, ASPR will work with potentially mRNA vaccines. mRNA vaccines, which some people wish to cast doubts upon for no other reason than people don't understand them, and so let's cast a doubt upon it. And beyond COVID, misinformation about the safety of routine vaccinations creates skepticism. Imagine that. Mothers and fathers confused as to whether vaccines are safe to give their children. As a result, we see thousands getting measles. We see, unfortunately, deaths from measles, a vaccine-preventable disease, just lying at the feet of folks casting misinformation on these issues. Parents should not have to guess whether information on the CDC's website reflects the best available science rather than the preferences of political appointees. This is what has led to children being hospitalized and dying from diseases preventable with the vaccine. So let me be clear, and I say this not as anything but an analysis of the data. Vaccines are overwhelmingly safe and effective. They have saved countless lives. Study after study shows they do not cause autism whether given at birth or whether given later in life. Hepatitis B is not just transmitted sexually or through drug users, and the best way to stop somebody from ending up with costly and expensive liver failure is through a birth dose. As a physician, as I've mentioned, I've had patients die from diseases they would not have died from had they been immunized. Any equivocation on these facts, and I shall not be able to support your immunization, your nomination. Because when trust is destroyed, it's hard to be effective. I go back to being a doctor. As a physician, you're taught to search for the truth and use the truth for your solutions. It's the only way you make the correct diagnosis and the correct prescription. Mr. Kaufman, when we met in my office, it was a very pleasant visit. I will say that things have come to light since then in the press that have been sent to me, that you have previously made comments regarding vaccines causing autism and questioned the necessity of the birth dose of hepatitis B. Additionally, you have said that you hate the CDC. I'm going to give you a chance to, wait, you're going to be involved with aspirin? You hate the CDC? I mean, like, what in the heck's going on there? Turmoil at the top of the nation's top public health agency is not good for the health of the American people, and it raises questions about how other public health and medical agencies like ASPR operate. We need unbiased leaders who make decisions based upon science, not politics or ideology, and are committed to protecting children's health. Some of my colleagues on the other side of the aisle have expressed regret for not voting to confirm Dr. Monarez to lead the CDC. Today, we'll again have a very strong nominee to lead the CDC. I ask you to listen with an open mind and to consider supporting someone who is a highly qualified nominee committed to facts and science. If confirmed, Dr. Schwartz and Mr. Kaufman, you will be tasked with bringing stability and restoring public trust in HHS. I look forward to hearing how you will accomplish this. With that, I recognize Senator Sanders.
Thank you, Mr. Chairman. Let me thank Dr. Erica Schwartz, who has been nominated to be Director of the Center for Disease Control and Prevention, CDC, and Sean Kaufman, who has been nominated to be the Assistant Secretary for Preparedness and Response, for being with us today. Mr. Chairman, let us be clear. The major reason we are here today is because Secretary Kennedy fired Dr. Susan Monarez, the first Senate-confirmed CDC director, after less than 1 month on the job. So, why did she get fired after being on the job for less than 1 month? What crime did she commit? Well, I don't think it's complicated. Dr. Monarez, it turned out, refused to act as a rubber stamp for Secretary Kennedy's very dangerous agenda to limit the use of safe and effective vaccines. Dr. Monarez, to her credit, stood up for science, for public health, and for the scientific method. Frankly, she stood up for protecting the well-being of the American people, and that was the reason that she was fired. And Mr. Chairman, what has taken place since that firing? Last year, the United States had the worst measles outbreak in over 30 years, with nearly 2,300 cases reported. We are on track to surpass that number this year. In April, there was a global outbreak of hantavirus linked to a cruise ship. 13 people got sick and 3 people died. Now an Ebola outbreak is spreading in the Democratic Republic of the Congo and Uganda, with over 1,900 cases and over 700 deaths reported. It's the third largest Ebola outbreak ever reported, and no treatment or vaccines exist yet for this strain. In the United States, vaccination rates are falling. Let me repeat that. Vaccination rates are falling. Children are now in danger of getting sick and dying from illnesses that vaccines could have prevented. Secretary Kennedy's response to these crises has been to spread misinformation, fire scientists who disagree with him, and wage an unprecedented war on science and vaccines that have saved millions of lives. Mr. Chairman, as you well know, our committee received 250 pages of emails from officials at the CDC and HHS that have confirmed what many of us have feared. These emails have shown that Secretary Kennedy tried to make it more difficult for working families to get vaccines for their children at no cost. He directed CDC staff to pursue the bogus link that vaccines cause autism, a link that has been thoroughly debunked by the scientific and medical community. He has spread misinformation about the largest measles outbreak in the U.S. in over 30 years. And Secretary Kennedy stopped a flu vaccination campaign during a flu season that had killed 16,000 people. Mr. Chairman, bottom line here is we need people in HHS who have the courage to stand up for science, to protect our kids, to protect the health and well-being of the American people, and to stand up to a secretary who is moving this country in a very dangerous direction. Thank you.
We shall now proceed with opening statements. Dr. Schwartz.
Chairman, ranking member, and distinguished,
I'm sorry, I'm supposed to read your bio. Imagine
Okay.
that. You know what I'm saying? My bad. We're joined today by Dr. Erica Schwartz, nominee to be the Director of the Centers for Disease Control and Prevention, or the CDC. She is board certified in occupational medicine. She served as a Navy occupational medicine physician before joining the Public Health Service Commission Corps to serve the Coast Guard in 2005. She served as the Deputy Surgeon General from January 2019 to April 2021. She earned a BS in biomedical engineering and her MD from Brown University, an MPH from the Uniformed Services University of Health Sciences, and a JD from the University of Maryland. Thank you for being here, and thank you for your dedication to public health and military service.
Thank you, Chairman. Chairman, ranking members, distinguished members of the committee, thank you for the opportunity to appear before you today. It is truly an honor to be nominated for the role of Director of the Centers for Disease Control and Prevention. I'd also like to thank President Trump and Secretary Kennedy for the trust they placed in me with this nomination. I am deeply honored by the opportunity to continue serving our nation. I would also like to recognize my husband, whose unwavering support has made a lifetime of service possible. The most important thing to know about me is that I come from a God-fearing military family. My father and my older sister were in the Navy, my older brother was in the Marines, and my younger brother was in the Army. And I had the privilege of serving both in the Navy and with the Coast Guard. For my family, service was not a job. It was a calling, it was a responsibility, and it was an act of faith. My academic career included a biomedical engineering degree and a medical doctorate from Brown University, a Master of Public Health in epidemiology, and a law degree. After medical school, I served as a Navy occupational medicine physician and clinical epidemiologist, focused on protecting service members from hazardous exposures while learning public health from a mission-first operational perspective. I later transferred to the United States Public Health Service and was detailed to the Coast Guard, where I focused on force health protection for responders to major national and global crises, including Hurricanes Katrina and Rita, the 2010 Haiti earthquake, the Deepwater Horizon oil spill disaster, and the West Africa Ebola outbreak. In each of these moments, the men and women of the Coast Guard counted on me to get it right. There was no margin for error. I eventually served as the Coast Guard's Chief Medical Officer at the rank of 2-star Admiral, where I was responsible for the Coast Guard's healthcare system, their safety system, and their work-life program. I was later asked to serve as the United States Deputy Surgeon General. During my tenure, our nation faced one of the greatest public health threats in modern history, the COVID-19 pandemic. one of my core responsibilities was ensuring access to diagnostic testing without overwhelming the healthcare system. My team and I rapidly designed and operationalized a scalable public-private solution. We established drive-through testing sites in every state in Puerto Rico and the District of Columbia, testing nearly 11.5 million individuals. Public health is in my DNA. I'm here because I want to continue serving our nation and because I believe deeply in the mission of the CDC. If confirmed, my first priority will be restoring trust in public health institutions through radical transparency and unwavering scientific integrity. As CDC director, my sacred responsibility is to provide the American people with public health guidance that is clear, honest, and evidence-based. I will never betray the science. Second, we must modernize the CDC into a near real-time public health enterprise capable of detecting threats early and responding faster. 21st century threats require 21st century systems. Third, we must empower states, tribes, local communities, and territorial partners as the operational backbone of American public health. Public health works best closest to the people. The CDC should provide tools, embedded expertise, operational support, and funding flexibility, not rigid top-down control. The CDC is home to an extraordinarily talented and dedicated workforce. If confirmed, I would support them, empower them, and ensure they have the tools and leadership necessary to succeed. At a time when trust in institutions has been challenged, we have an opportunity to restore confidence, strengthen scientific integrity, modernize our systems, and refocus on the CDC's core mission, protecting the health and safety of the American people. I am committed to working with this committee, with public health leaders across America, with communities across our nation, to ensure the CDC fulfills its mission with excellence, integrity, transparency, and accountability. Thank you for your consideration. I look forward to your questions.
Thank you, Dr. Schwartz. Next, we are joined by Mr. Sean Kaufman, nominee to be the Assistant Secretary for Preparedness and Response, or ASPR. Mr. Kaufman earned his Bachelor of Science and Master of Public Health degrees from San Diego State University with a focus on health promotion and behavioral science. He has 30 years of public health experience with a focus on infectious disease preparedness, biosafety, biosecurity, and emergency response. He has served in leadership roles at CDC, Emory University, and in the private sector where his work focused on improving biosafety through a culture of responsibility. He also founded Safer Behaviors, a firm that delivers behavioral-based training to clients globally. Thank you, sir, for being here. We look forward to hearing from you.
Thank you, Chairman Cassidy, Ranking Member Sanders, and members of the Senate Help Committee. Thank you for the opportunity to appear before you today as you consider my nomination to serve as Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. I am deeply honored by this nomination and grateful to President Trump, Secretary Kennedy, for their confidence and trust. Most importantly, I thank God and my family. I'm especially grateful to my wife, Jacqueline, my daughter, Jamie Lynn, and my brother, Kevin, who are with us today. I also want to recognize my father, a retired United States Marine Corps officer, my brother, a retired FBI special agent, and my son, Aiden, who currently serves as a United States Army aviator flying Black Hawk helicopters. Along with my son, Sean Patrick, my family has dedicated their lives to serving this nation in different ways. Their sacrifices and those of my mother have been greater than anyone should ever have to bear in support of my career in public service. Their love, encouragement, and unwavering support have made this moment possible. I am forever grateful. I am equally thankful for my mentors, my colleagues, and friends who have shaped my career. I also want to recognize the extraordinary men and women who protect America's health every day, some of which are engaged with Ebola overseas. From ASPR, CDC, all of Department of Health and Human Services, the Department of State, to healthcare systems, laboratories, emergency responders, and organizations like Samaritan's Purse, these professionals stand between crisis and recovery. Today, as Americans continue supporting response to Ebola overseas, they remind us that preparedness is never theoretical. It's lived every day through service and sacrifice. For more than 30 years, I have dedicated my career to protecting people from biological threats. My work began during the HIV/AIDS pandemic and has included responses to the September 11th attack, the 2001 anthrax attacks, SARS, H1N1, Ebola, and COVID-19. I led preparedness efforts for the Emory University Ebola Treatment Unit, which cared for the first Ebola patients treated in the United States and deployed to Liberia and Nigeria through the West Africa Ebola epidemic in 2014. Throughout my career, I have worked to strengthen preparedness before disasters occur and improve responses when they do. I have seen firsthand the life-saving impact of vaccines. Let me be clear, vaccines save lives. They are safe and effective and remain one of the most important tools in public health for preventing infectious diseases and protecting the American people. The threats facing our nation continue to evolve. We must remain prepared for emerging infectious diseases, deliberate biological threats, and increasingly complex challenges driven by advances in biotechnology, artificial intelligence, and rapidly changing technologies. At the same time, chemical, radiological, nuclear, cyber, and natural disasters are all hazards that require an integrated approach that is faster, more agile, and more resilient than ever before. ASPR exists for one reason: to save lives. There is no greater responsibility in public service, and if confirmed, I will devote myself fully to that mission. My priorities will be straightforward. First, I hope to strengthen and reauthorize PAPA with all of us together to keep pace with today's threats while improving coordination and accountability across the government. Second, I want to accelerate the development of medical countermeasures, which includes vaccines, therapeutics, diagnostics, and other life-saving capabilities so America is never caught unprepared. Third, I want to invest in the people who make preparedness possible: our healthcare workers, emergency responders, laboratorians, public health professionals, and scientists, ensuring they are trained, equipped, and supported for the challenges ahead. Fourth, I'd like to modernize how we develop, manufacture, stockpile, and deliver critical medical resources so they reach Americans quickly when every minute matters. And finally, I want to strengthen partnerships across the federal government with our state, local, tribal, and territorial partners while working closely with healthcare systems, industry, academia, and nonprofit communities. Preparedness is a shared responsibility, and our success depends on working together before a crisis, not simply reacting after one begins. Throughout my career, I have learned one enduring lesson. Preparedness is not measured by what we are doing during a disaster. It is measured by what we do before one arrives and how we commit ourselves to those who have survived. If confirmed, I will lead with integrity, urgency, humility, and accountability. I will work every day to ensure that when the next emergency comes, and history tells us it will, the American people have confidence that their government is prepared to respond quickly, effectively, compassionately, and in the manner worthy of trust. Thank you, and I look forward to your questions.
Dr. Schwartz, your predecessor was let go because she would not make decisions that she felt she was instructed to make, that she felt were going to be bad for public health. She did not have the ability to demote or reassign people, and she objected to decisions, and because of that, according to her, was brought in and browbeaten and eventually let go. What commitment, one, will you commit to this committee and to the American people to have the same integrity as she, that if it asked to do something which is wrong for public health, that you will stand up as she did, object, if necessary, publicly?
Chairman, thank you for the question, and thank you for meeting with me earlier. The one thing that I can tell you is how I lead and how I live, and I have lived and I have led by my integrity. I have spent over 25 years in the uniformed services leading by integrity. That is what I can commit to you and to the committee, that I will continue to live and lead by my integrity. You are a physician, I'm a physician. We both took the Hippocratic Oath. For me, the Hippocratic Oath meant that I would never harm my patients, their health and well-being took primacy. If I'm confirmed as a CDC director, the nation's health and well-being will take primacy, and I will never compromise on that.
Now, we know that the Secretary has put people at the CDC who are there basically to look for evidence, however they can find it in fishing expeditions of how vaccines may cause problems. They can't find it, but they keep on doing it. Now, have you been told that you'll have the ability to reassign people who are being counterproductive in terms of promoting trust in public health measures, which have been shown time and time again to be safe?
Chairman, I am sitting here because the president nominated me and the secretary and I have had conversations. And those conversations were about my background. The fact that I spent 25
Let me interrupt.
years.
I have limited time. This is almost a yes and no. Will you have the ability to reassign, demote, get rid of people who are harmful to our public health venture based upon the scientific knowledge that is generally known, because the unwavering scientific integrity, as you say, with evidence-based and free from political science, not betraying science, standing on science, speaking the truth, even in difficult moments. Will you have the ability to do that with free of political interference?
Chairman, the secretary absolutely will allow me to be the CDC director. That is why I'm sitting here before you. The
Yes, but
secretary knows
and I
that
almost feel like I'm having to go after this question a little bit more firmly than I feel like I should. You can be CDC director and just take orders. We need a CDC director that will actually stand up to crazy, stupid things being said that undermine faith in immunization. Are you the person, and I'm being very direct here, because obviously I feel like we've got thousands of kids hospitalized because people have promoted that immunization is bad, and now kids have died because of it. It is evil to do that, and people persist. You are the bulwark. So I'm asking, will you have the ability and the firmness to stand up to that political meddling, to say, no, that's wrong and this is right?
Chairman, you have my assurances that I will continue to lead by my integrity. I will never compromise on the science. I will always, always have the public's health in mind. I have spent over 25 years making sure that my
That's not quite the direct answer I'm hoping for. I'm just saying that. And I know you've been through a murder board. One more time. I believe you're a woman of integrity. I accept that. But will you have the ability to say no to junk science and to say yes to that which has been firmly established and to stick up for what is actually right and true as opposed to that which is superstition and prejudice?
Chairman, I have always stood up for what is right and what is true, and I believe that I will continue to do that. You have my assurances that I will do that. I will never betray the science, ever. I will go where the science leads us. I will not have predetermined answers to conclusions. I will make sure that the CDC is focused on scientific rigor, that the CDC is focused on radical transparency, as we discussed in your office, and that the CDC, which is the most important thing to regain public trust, is that we lead with humility. There is an arrogance that—
Excuse me, because I'm almost out of time. Radical transparency includes if somebody puts people beneath you or above you or around you and will not let you remove them, but they are doing wrong things at the CDC, pursuing an agenda harmful to America's public health, and we've seen evidence of that. It's not a theoretical. How will you handle that situation?
Chairman, I am not obviously there at the CDC, but you have my assurances that if I am confirmed as a CDC director, I will work with the team, the principal deputy director, Sean Slavinsky, who's already on the ground, and the deputy director, the chief medical officer, Dr. Jennifer Shuford, to have those conversations. And if there's something that comes up that is concerning, you have my assurances that I will answer any questions that this committee has regarding exactly what you just mentioned.
Senator Sanders.
Thank you. Dr. Schwartz, thank you very much for your service over the years. According to the American Medical Association, which represents over 270,000 doctors, quote, "An abundance of evidence from decades of scientific studies shows no link between vaccines and autism," end quote. In fact, there have been more than 40 scientific studies in 7 countries involving over 5 million people, finding that there is no link between vaccines and autism. And yet, today, the CDC has published false information on its website suggesting that childhood vaccines cause autism. Dr. Schwartz, do you agree the existing scientific evidence shows vaccines do not cause autism? If confirmed, will you commit to removing information on the CDC website suggesting a link between vaccines and autism?
Senator, we do not know what causes autism. 1 in 33 children have a diagnosis of autism spectrum disorder, and we owe it to the American people to figure out why. The president has asked Secretary Kennedy to find out what is causing
Look,
the
I don't have a
increase
lot
in
of time,
autism.
and we all want to find the cause of autism. The evidence is overwhelming that vaccines do not cause autism. Do you accept that evidence?
I do accept that evidence, Senator.
If confirmed, will you commit to removing information on the CDC website suggesting a link between vaccines and autism?
If confirmed, Senator, you have my commitment that I will look at that exact website. I have not seen that. I will speak with the secretary to understand why
But the
that
secretary
information-
has put that stuff up there. What I'm asking you is, will you remove information which suggests a link between vaccines and autism?
Senator, I have been in many situations where I have had to go to my superiors in the military to have conversations, very difficult conversations, about things that may not have been that may have been concerning to the troops or to the military personnel. And I will do the same with the secretary. I will go to the secretary.
Sorry
if
to
there's
interrupt you.
something-
I just have a brief amount of time. In August of last year, Secretary Kennedy's chief of staff sent an email to the previous CDC director demanding that, quote, "CDC political leadership all have eyes on the decisions for approval changes before they go into effect, make America great," end quote. Within days, the CDC director was fired for failing to approve Secretary Kennedy's anti-vaccine agenda. Dr. Schwartz, if confirmed, will you commit that you will report to Congress if you receive directives from Secretary Kennedy or any other individual in the Trump administration to implement policies that are unscientific and could harm the health and well-being of the American people?
Senator, I do not believe that the president or the secretary would ever do what you just mentioned. but you
Really? Do you think that is the record? He would not do that? Is that what
Senator,
you're saying?
Senator, that I do not think that the secretary or the president would ask me to do something like that.
Okay, thank you. Mr. Kaufman, in 2022, you said that, quote, "You would rather perish," end quote, "than have any of your 3 children," quote, "receive an injection of the COVID vaccine where the risks soundly outweigh the benefits gained," end quote. Is that a true statement?
Yes, it is, Senator.
And yet in 2021, President Trump called the COVID vaccine, quote, "one of the greatest achievements of mankind," end quote. I don't usually agree with President Trump, but it certainly was a great achievement. So who is right? Were you right, or was President Trump right?
Senator, I think we are both right. If I may explain that, because I think there have been several things, and Chairman Cassidy alluded to it earlier, that have been mischaracterized. My children, thank God, are young and healthy. And right before that post, I had taken them to a Kroger, looked at antibodies, and they were all antibody positive for COVID-19. And the risk-benefit equation for my children didn't exist. However, and this is very important, and I want to mention Trish Lawrence. Trish Lawrence is my wife's mom, who recently passed away from PLS. She had a condition, a very serious condition during COVID. And I recommended not only for Trish Lawrence, but her husband, Frank Lawrence, to get the COVID-19 vaccine because it was very appropriate in that circumstance. I believe 100% that vaccines are safe and effective and that we should have conversations with our physicians to make a determination on which and what is the best risk-benefit equation for that patient.
Thank you. Mr. Chair.
Mr. Chairman, thank you. And Dr. Schwartz, Mr. Kaufman, thank you for being here and your willingness to serve. A lot of discussion this morning about vaccines and vaccine policies. Know that I share the concerns that the chairman has outlined with what happens to an erosion of public trust when you have decisions that are advanced that do not appear to follow the science. I have mentioned in this committee multiple times the example that Alaska set some decades ago. We had historically very, very high hepatitis B rates, the highest in the nation, particularly in our Alaska Native communities and with Alaska Native children. And they embarked on a very ambitious, aggressive campaign, but effectively through screening and vaccination and sustained universal newborn immunization, they have virtually eliminated hepatitis B transmission in these communities and prevented new cases of hepatitis B liver-related causes, cancer, which again the chairman has mentioned. And I look to that as just one extraordinary example of the value. And I know that, Mr. Kaufman, you have made statements previously as it relates specifically to the hepatitis B vaccine. And my question to you this morning is whether you agree that the hepatitis B birth dose remains an important tool for protecting high burden and rural states such as Alaska.
Senator, thank you for the question. And to give you an answer other than yes, I will tell you that all three of my children, who I love more than anything, have received the infant dose of the hepatitis B vaccine.
I think these are important because these types of clarifications are important because you see reference that unless you are a drug user or sexually, your concerns about sexually transmitted diseases. But again, when we're talking about those vaccines that can be given at birth that can prevent these horrible deaths, I think it needs to be made clear. We get back to the issue of how do we establish public trust here. I mentioned many of our tribal communities, and we face in the state of Alaska challenges when it comes to public health emergencies, natural disasters. It requires our tribal communities to rely on close coordination with ASPR, with the Indian Health Service, tribal health systems, the Public Health Service Commission Corps, which I appreciate your leadership there, Dr. Schwartz. But there's just a lot of challenges. The challenges come with geography, limited health infrastructure, workforce shortages. And so directed to you, Mr. Kaufman, how could you envision strengthening ASPR's partnership with IHS, the tribes, and the Public Health Service Commission Corps to ensure that we're able to respond timely and get effective support, because this is where we see the lags?
Thank you, Senator, for the question. My past experiences in emergency response, one of my greatest worries is that emergency responders come in like seagulls. They fly in and then they fly out, and they leave the community with all the issues that they had before, and sometimes leaving the community worse off than better off. In hearing Dr. Schwartz talk earlier, she has said that public health is always local, and I will say that emergency response is local as well. When something goes wrong, the community knows best, and it's always a great strategy to let the community lead during emergency situations. So my plan would be to come in, strengthen existing partnerships, ensure that individuals are empowered to respond, and that they can serve their communities as they see fit.
Well, I appreciate that. I think we saw the benefits in delivering the COVID vaccines, where there was that on-the-ground response that really made that difference. Dr. Schwartz, Again, sticking with Native communities, as we know, you and I have discussed health disparities that we really need to be focusing on. I introduced yesterday a bill entitled the Native Children's Commission Implementation Act. It directs CDC to improve the quality, accuracy, and completeness of maternal and infant health data for American Indian, Alaska Native, Native Hawaiian populations by strengthening partnerships with tribes, tribal epidemiologist centers, and other Native partners. I'm just going to ask you if you are confirmed to work with us to address some of these long-standing challenges that we see with racial misclassification, with underreporting, and really just incomplete data collection. We have to do a better job as we're addressing maternal mortality issues and ensuring that our Native communities are adequately represented in the data that helps inform.
Senator, you have my commitment to work with you and your team to make sure that we understand exactly what you submitted and to make sure that we're looking at that to your satisfaction.
It's not just in that population, but in so many others that are underrepresented, and I know we have more work to do. Thank you, Mr. Chairman.
Thank you, Senator Murkowski. Now Senator Baldwin.
Thank you, Mr. Chairman. Mr. Kaufman, I have been seriously concerned by Secretary Kennedy's repeated actions to limit the use of vaccines and spread misinformation around the safety and efficacy of vaccines. Investing in new vaccines and innovative vaccine technology is critical, particularly during an Ebola outbreak and global health emergency. We need to be prepared for everything from the next pandemic to the next bad flu season. So I'll start with what I hope will be an easy question for you. Mr. Kaufman, do you believe that mRNA vaccines, including the COVID-19 vaccine, are safe and effective? Yes or no?
Senator Baldwin, yes, I do.
Thank you. Your statements that were referred to earlier under examination by Senator Sanders, where you indicated that you would rather, I think the quote is, as a father of three who would rather perish than have any one of his children receive an injection, caused a lot of concern, and I think you're going to have to do some strong work to clarify your views on this topic. I'm going to ask the same question to you, Dr. Schwartz, but first I want to thank you for your service to this nation. Dr. Schwartz, do you believe that mRNA vaccines, including the COVID-19 vaccine, are safe and effective?
Senator, thank you for meeting with me earlier. I do appreciate that. I will say for the record, you do have the most beautiful office in the Senate. That being said, I do believe that mRNA...
You're all welcome over afterwards, yeah.
I do believe that mRNA technology is safe and effective.
Thank you. I appreciate that. Unfortunately, vaccine policy is just one example of political interference that you've heard several senators reflect upon in public health decision-making that we've seen during this administration that impacts the safety of Americans. This spring, a study about the effectiveness of COVID vaccines was suppressed within the Department of Health and Human Services. Public health grant awards now undergo a political scrubbing before they are awarded. The administration has now proposed adding a new office to formalize political review of CDC actions. If that isn't bad enough, a recent OMB proposed rule would create a government-wide mechanism requiring political review of every discretionary grant, add restrictions on what funded researchers can publish, and expand the government's authority to terminate grants on a whim. We need a CDC director that can demonstrate independence from political decision-making and a willingness to stand up when necessary to Secretary Kennedy. Dr. Schwartz, you have said many times that one of your top goals as CDC director would be to bring back trust to the CDC. How do you go about accomplishing a goal like that if the views of scientists can be overridden by political appointees? How would you operate in an environment, as I've just described, where there is now going to be political scrubbing of every discretionary grant from the agency?
Senator, thank you for the question. As you heard in my opening remarks, restoring trust to the CDC is my number one priority. And I look at it in three ways. The first thing that I must do, that we must do, is to go where the science leads us, no matter what. Scientific integrity is core. The second thing is that radical transparency, and a lot of folks don't understand what radical transparency means. And the way I think about radical transparency is when I was with the Coast Guard, I was the medical unit leader in Deepwater Horizon, and there was a lot of confusion on the ground. I had a pilot who came up to me, and he was very concerned about his exposure to the dispersants that were being used. And he asked me, Doc Schwartz, am I gonna get cancer? If I get exposed to this corrects it. And the radical transparency that I had to utilize was to tell him that I did not know. I didn't know if the mixture of Corexit, dispersants, the toxins in the water would cause this individual to have cancer long term. But what I did tell him was, A, I didn't know, but he was going to be enrolled in a long-term surveillance program so that if any health effects happened, we would know it. And that assurance, even though I didn't know the answer to his question, that assurance was enough for him to complete the mission effectively and successfully. That's the radical transparency that the American people want to know. They want to know what we know, what we don't know, and why we don't know it. And the third thing that's critical is leading with humility. I want to be the CDC director for all Americans. I don't want to be a paternalistic CDC director. I want to be a CDC director in a very similar manner as I was an occupational medicine physician, a patient-centered physician. I want to be a nation-centered CDC director.
I appreciate those sentiments so much, and I just want to say that in the context of an agency that is suppressing studies and having political scrubbing of grant decisions, that's going to be a real challenge, and I want you to convince me that you are going to be able to push back against those attempts to interfere with radical transparency.
Senator Marshall.
Thank you, Mr. Chairman. For both of you, I'm going to ask you in a second about active pharmaceutical ingredients. You don't have to tell me what the problem is. I want to talk about solutions. But before I get to that, I just want to compliment both of you, two of the most qualified people I've seen in front of us. Dr. Schwartz, incredible resume, two-star admiral. Just congratulations and thanks for, and most importantly, your culture, your values, all those things that I sure hope that my kids and grandkids look up and say, that's the type of person I want to be and the type of position I want to have. And Sean Kaufman, I think you're the right person for ASPR right now. I think it's always good to go back and look at the fundamentals. So what is ASPR? You know, this is something I didn't know of till I got here, even though I'm a physician, that it's the Administration for Strategic Preparedness and Response. Your motto, stand ready, move fast. Your charge is in charge of medical public health preparedness, response, and recovery. And I believe that for such a time as this, you've been prepared to do this job. Your resume, hands-on experience inside public health laboratories, frontline response experience to anthrax attest, West Nile's virus. You understand federal infrastructure and interagency coordination. You've led private sector innovation in behavioral safety and disaster preparedness. Sean Kaufman combines deep technical knowledge, real-world response experience, and proven leadership. Exactly what we need to keep Americans safe. Now, so often this committee seems like all we care about is vaccines. It's 1% of both of your world, maybe more, maybe less. And I happen to agree there's concerns about the mRNA technology. It's short-lived. They don't stop the virus. There are significant risk associated, especially young males. especially young males that have positive antibodies, right? And like you, I gave different advice to my parents than I did my kids. But I guess what I'm looking for, Mr. Kaufman, is let's just say it's the next virus, it's the next epidemic. Are you committed to making sure that America has access to whatever vaccines that you deem safe and worthy to put in the hands of doctors to make that same recommendation for their patients?
Senator Marshall, thank you for the question. I also want to thank you. I've actually done a lot of great work in your state at the USDA in Bath, and I want to acknowledge the staff is phenomenal and excellent there as well. To answer the question, I will be committed to lead a phenomenal team at ASPR. Primarily, there's a small organization many may not hear of, an island of excellence called BARDA. Sure. And BARDA is responsible not only for looking at new technologies, because what we face today is we face the ability of our adversaries to actually genetically modify organisms, creating novel threats that actually pose and put Americans drastically at risk, very similar to what we saw at COVID. Right. So BARDA is not only interested in creating vaccine countermeasures to protect Americans, but also therapeutics so that when Americans get sick, they
But, Mr. Kaufman, I'm trying to get you some votes here.
Yep.
Are you committed to getting the vaccines into the hands of doctors and nurses and regardless of anything that's ever been said?
Absolutely, 100%. I'm sorry I missed the softball.
Yeah, there you go. Dr. Schwartz, I mentioned the API. You and I know what the huge problem is. What's the solution to bring API back home? Active pharmaceutical ingredients, yeah.
Senator, I actually have to get smarter on that. I have to be brutally honest here. I haven't been really following that, but I would definitely love to work with your team. And
My guess is the diagnostics that you're using, the therapeutics you want available will take API, Mr. Kaufman. Now maybe it's a BARDA turn.
That's right. Yeah, there's new technology. You know, right now, as you know, there's a problem, and I'm so happy that you acknowledge it's actually a very, very big problem. BARDA can look at technology that actually uses different types of ingredients that can undermine the adversaries and put a need on more of a biological basis for future countermeasures than a chemical one. So there are different strategies and technologies that the scientists at BARDA are looking into and will begin to explore to protect America.
But this is the problem that this committee needs to be looking at. This is the real problem. I mean, it's great to see the manufacturing moving back here, that we're making vaccines, we're making drugs again in this company, but we don't have the API to do it. And very few companies are doing it, and I hope this committee can take on that challenge and whatever we can do as a congressional body as well. Thank you, Mr. Chairman.
Thank you, Dr. Marshall. I think it's Senator Kane.
Mr. Chair, and congratulations to the witnesses, Dr. Schwartz and Mr. Kaufman. I appreciated both of our visits. Dr. Schwartz, I'll just begin this way. I cast votes that I sometimes regret. I have cast some votes in favor of some Trump nominees that I've come to regret, but I've also come to regret a vote that I cast against a Trump nominee, and it's the predecessor, Dr. Menara's. She was before us, and I thought she was very qualified, but I wondered whether she would have the backbone to stand up to political pressure. And it's interesting, Senator Sanders asked a question that I think I asked in almost the same verbiage. Will you resist political pressure applied by the secretary or the president? And her answer was, they would never do such a thing. And I thought, wow, I think you're wrong. So I voted against her. And she did demonstrate the backbone that I thought was really remarkable. And I apologized to her at a hearing, a year or so later. Your answer was almost exactly the same as hers. I don't think I'll ever get asked to do such a thing. Now, look, that's kind of a theoretical, hypothetical question. So actually, I'd kind of like to ask one that is not theoretical or hypothetical, but that's a very live issue right now, and it deals with tobacco and the Office of Smoking and Health at the CDC. In April of 2025, the entire Office on Smoking and Health was eliminated. Now, this is an office that is in statute, and it's an office that receives congressional appropriations, but the Trump administration eliminated it. The contractors supporting the office were fired, and the employees who have lost their jobs, actually, they've been on administrative leave getting paid for not doing their job while the legality of their firing is being contested in court. The elimination of the CDC's office has weakened the nation's longest-standing tobacco control infrastructure. And meanwhile, the tobacco industry is filling the void. They're expanding their influence through the FDA authorization process. So, as an example, in May, the FDA authorized 4 new flavored e-cigarettes, the flavors that attract kids to use e-products, mango, blueberry, and others, directly appealing and I think addicting young people. In May, the FDA issued enforcement guidance stating that it wouldn't prioritize enforcement products that have not been approved, so long as they have a pending application that's been accepted for review. So there's been a real effort to dismantle 40 years of tobacco control infrastructure, particularly as it goes to this issue of young people. So here's what I want to know. You don't have any role in the FDA process, and I get that. But if confirmed, will you commit to spending congressionally appropriated dollars for the Office on Smoking and Health on fact-based tobacco control programs free of tobacco industry influence, and bring back a sufficient staff infrastructure to make sure that you can carry out the mission for which Congress appropriates funds to the CDC?
Senator, thank you again for meeting with me earlier, and thank you for the question. As a board-certified occupational medicine physician, you are speaking about something that is near and dear to my heart. I ran the health promotion clinic when I was in the Navy at the Naval Health Clinic in Annapolis, and the number one thing that I focused on was smoking cessation. As you know, smoking has so many significant adverse outcomes, whether it's cardiovascular disease, whether it's COPD, whether it's certain types of cancers. So I am very much concerned that what you just mentioned, I was not aware of, that is happening. You have my assurances that if I am confirmed as a CDC director, that I will work with your team, your staff, and work with you to understand if we are appropriated for this particular office, why we are not, in fact, having that office being actively.
Well, and why it hasn't been done is one thing, but going forward, see, we have both of the leaders of the Appropriations Committee on this committee. So Senator Murray is the lead Democrat, the ranking member, Senator Collins is the chairman. And when they appropriate money and Congress votes on an appropriation, we get the appropriations power in the Constitution. It's not a presidential power. The Congress writes the budget. And so my expectation of a CDC director is if we vote on an appropriations bill that says, here's the money for this office at the CDC, I don't care if it's the secretary, the president, or some blogger saying, well, we shouldn't spend the money. Once Congress votes for it, it's the law. And I would just like to know, will you follow the law if we appropriate money for this mission at the CDC?
Senator, I will always follow the law.
Thank you for that. My time is up. I'm going to just say one last thing. You and I had a good visit about the routing of commercial aviation from nations that are experiencing the Ebola outbreak into a few airports in the country, including Dulles, and the need to make sure that those who are dealing with travelers from these nations have public health expertise, but also there's a lot of employees at Dulles, and I imagine at the other 3 airports, who have their own questions. And you committed to me in my office that should you be confirmed, you would make sure that the CDC gets to these locations where folks are coming in to try to have forums and provide information to whether it's the air traffic controllers, flight attendants, folks who work in the retail establishments. In the means of radical transparency, we want to be able to answer folks' questions, and I appreciated your commitment on that. Thank you.
And you still have my commitment, Senator.
Senator Husted.
Thank you, Mr. Chairman. Mr. Kaufman, Dr. Schwartz, thanks for joining us today. I have a question for Dr. Schwartz about something that Ohio has a great connection to, and that is Creutzfeldt-Jakob disease, CJD, as it's commonly referred. It's a rare and always fatal brain disease, and it belongs to the family of illness called prion diseases, and it's right now there is no treatment for it or cure, and Ohio is playing a leading role in trying to change that because we have a research facility, National Prion Disease Pathology Surveillance Center in Cleveland, and it relies on CDC funding for the research that happens there. And it helps scientists understand how the brain disease occurs and how it's passed from person to person, or perhaps from animals to persons. And that gets me to the next part of this, which is chronic wasting disease, which is another type of this disease. It's a fatal condition. It resides mostly in deer in my state, but also can happen with elk and moose. And why? And it's been detected in over 36 states and across the country. Why does that matter? Because we harvest through hunting 200,000 plus deer a year, which people eat. And it's a way of maintaining the deer population in rural states all across our country. And so continued research and understanding of this is important. And the only way to really do that is through post-mortem human brain tissue analysis. And it's imperative that we continue to do this to monitor and understand how the disease works and how, if and how there's a transfer from animals to humans. And so what I am interested in your response to is just your reassurance that you will support the center's postmortem brain tissue analysis capacity as we have more research and done on this, that you would support additional research support if there's a backlog in this development of the postmortem analysis, and that you will ensure CDC effectively coordinates between itself and state health departments and others who are working on this to identify the laboratories and the research that's looking into this to make sure that we're controlling this disease and understanding it better, because if something like that happens where we get this transfer from animal to human beings, it's a huge, huge issue. So just want your reaction and reassurance on that particular issue.
Senator, thank you for the question, and thank you for meeting with me earlier. Whether it's CJD or CWD, certainly if I am confirmed as a CDC director, I would work with your team to understand what are the capacities of the CDC to look into these types of very rare diseases. I know their resource constraints are, something that is a reality, whether it's with the CDC or any other institution. So I certainly want to make sure that I was not aware of what you just described, but I want to make sure, if I am confirmed, that I work with your team and the career scientists at the CDC to see what is our capacity, what are we appropriated to do, and what we can do to address those issues.
Yeah, chronic wasting disease is spreading in our state. I think it's spreading in other states as well. As a result, as we head towards hunting season, this will continue to be something that you have a coordination with and necessary with the wildlife officers and health professionals and so forth. So just would very much appreciate your coordination and support of that as we, it's a big issue that not a lot of people talk about. It's kind of a niche issue, but it's important. So thank you, and Mr. Chair, I'll yield back the rest of my time.
Senator Hessen.
Well, thank you, Mr. Chairman, and good morning, Dr. Schwartz and Mr. Kaufman. It's good to see you both. Congratulations on your nominations, and congratulations and thanks to your families as well for supporting you in this. Dr. Schwartz, just a few minutes ago, you said in response to a question from Senator Kane, you will always follow the law. Mr. Kaufman, I assume that you would say the same thing.
That is correct.
So just to be clear, if the President of the United States instructs you to take an action that would break the law, will you follow the law or follow the President's instruction? Dr. Schwartz?
The President would never ask me to not follow the law, but I will always follow the law.
Mr. Kaufman?
We'll follow the law.
Thank you. And Dr. Schwartz, there are multiple examples of the President actively instructing people to break the law over and over again. So I hope you will update yourself on that, because it's not a satisfactory response to say he would never do that. Dr. Schwartz, the CDC director is responsible for protecting Americans and especially children from life-threatening disease outbreaks. If Secretary Kennedy ordered you to stop promoting the flu vaccine during a deadly flu season, would you carry out that order?
Senator, when I was the Deputy Surgeon General, I worked at the Office of the Surgeon General. And one of the things that was very concerning was that the Surgeon General had a number of campaigns, public health campaigns, that he wanted to do. And yet we had very limited resources.
Yeah, ma'am,
So
I'm asking you a different question, and I have limited time. So if you are instructed to stop promoting the flu vaccine during a deadly flu season, would you carry out that order, yes or no?
We had to prioritize what we could focus on, what we couldn't
Look,
focus on.
I'm going to stop you again. This isn't a hypothetical question. The flu season last year killed almost 300 children, and we have clear data from the CDC that the best way to save children's lives is by giving them the flu vaccine. Nevertheless, in the middle of the deadly flu outbreak last year, Secretary Kennedy personally directed the CDC to immediately stop all promotion of the flu vaccine, including promotion campaigns that were already planned and paid for. So I want to give you a chance to answer again. If the Secretary ordered you to stop promoting the flu vaccine during a deadly flu season for children, would you carry out that order, yes or no?
So, Senator, I don't speak in hypotheticals, but I
This isn't a hypothetical. It happened, and I've got the email if you want to see it later. So yes or no? Are you going to protect our kids, or are you going to follow an uninformed order from the Secretary?
Senator, I will always, always protect our children. I
So
will
you
protect
would
the health of-
refuse that order, yes or no?
Senator, my understanding of what happened back then was that the Secretary has various priorities. And as he's looking at his priorities in terms of what to fund, what not to fund.
I'm sorry, that's not acceptable. You just heard Senator Kaine talk about the appropriations process. The money was in the budget, it was there, and it protects and saves lives. And your answer is really disappointing. Let's go on to another issue. Federal regulations and decades of precedent make it clear that if confirmed, you would be at the top of the chain of command for vaccine recommendations to the public in the United States. So, Dr. Schwartz, do you agree that you will be at the top of the chain of command with regard to final vaccine recommendations?
Senator, my understanding is when the Advisory Committee on Immunization Practices makes a recommendation regarding vaccines, they've been doing this since the 1960s. The CDC takes those recommendations. The CDC director will work with this career scientist, work with the chief medical officer of the CDC to analyze those recommendations, look at the evidence that the ACIP used to make those recommendations. And then the CDC director certainly can make that decision regarding should they accept or not accept those recommendations. But I also understand, and I could be wrong on this, that the Secretary ultimately has the policy decision regarding that.
Let me update you. The president here is clear, and even the recent charter that Secretary Kennedy's new ACIP will operate under makes clear that the recommendations go to the CDC director. The CDC director, after consultation, examining the recommendations, all the things you just said, decides whether to adopt those recommendations or not. And then the charter says they inform the secretary. The buck stops with the CDC director when it comes to vaccine recommendations. So do you commit that you will consider and make decisions on vaccine recommendations from scientific experts without political interference from outside the chain of command, including Secretary Kennedy or President Trump?
Senator, your premise is interesting. I don't think the Secretary or the President would do what you just said, but you have my commitment to follow the science wherever the science may lead.
The Secretary has interfered with vaccine recommendations to the point that he has dismantled ACIP and rewritten the charter in an attempt to provide a particular scientific, or I would say unscientific, view on vaccine safety. It is outrageous, and it is making us less safe. And I hope very much, if you are confirmed, that you will stand up to that kind of political interference. Thank you, Mr. Chair.
Senator Tuberville.
Thank you, Mr. Chairman. Thanks for both being here today. Thanks for your willingness to serve. Thank your willingness to go through the education that you've gone through. And thanks for your dedication to our country, talking about vaccines. I would hope the federal government would stay out of the damn vaccine business. I've got young grandkids that they want them to take 70 vaccines before they're 2 years old. That is bullcrap. Let the parents decide that decision. That doesn't need to belong in the federal government. Now, if y'all want to recommend it, I'm all for that. But my God, let's get away from this nonsense. I want to get into something that the Biden administration got involved in. It's called monoclonal antibodies. Most of us never heard that. But it was saving lives, and the Biden administration wouldn't let you have it unless you had the damn vaccine. That is ridiculous. That is ridiculous. So, Mr. Kaufman, how are you going to handle that situation if and when we have our next disaster in this country caused by humans, basically by the federal government got involved in COVID. How would you handle that?
In 2014, Senator, thank you for the question, I had the opportunity to serve at Emory University's healthcare unit where Dr. Kent Brantley and Nancy Ribel were treated for Ebola during the 2014 epidemic. I witnessed firsthand. I saw a gentleman who was close, as we would say when we serve on the front line with Ebola, compassionate care is about what we're going to offer at this point. I saw a gentleman within hours after taking a dose of monoclonal antibody therapy come alive, so much so that we actually ordered Chick-fil-A for him, and that's in his book. He could read that. I also have a brother who got COVID really, really bad. And he went in Florida and got monoclonal antibody therapeutic solutions and recovered very, very well. I believe that with the threats that we face today, with the ability to identify through genome sequencing and customize monoclonal antibody therapeutic solutions, that we must be absolutely prepared with this technology, and it must be ready to roll to be more prepared today than we've ever been before.
Thank you. In previous administrations, no, unless you take the vaccine, you can't have these. That's the stupidest thing I've ever heard. We kill millions of people that shouldn't have been killed because of that decision. We're worried about vaccines. Yeah, we got great vaccines. Let's give them if we want to. If people don't want to take them, the heck with it. That's our right. This is a free country. That's the reason we don't have trust in this country. So, Mr. Kaufman, how are you going to get trust back into our country through your position? Because my state of Alabama, they don't trust health. They don't trust federal government, and I don't blame them, but they surely don't trust the health in our country.
Thank you, Senator, for that question. As a private businessman, one thing that I would always do to evaluate whether we did a great job or not is we would ask our clients upon finishing the work, are we trusted more than we were before? And I think the indicators today are, well, maybe during COVID we didn't have necessarily the best showing in public health. And I appreciate the question because it gives me a chance to address something as well. Earlier, I was asked by a senator, are the mRNA vaccines safe and effective? Absolutely, but you know what? I'm not going to put an asterisk because, and this is important, many, many, many millions and millions of people around the world took those vaccines and did not suffer. But I cannot sit here and forget the ones that did. With any medical intervention, there will always be adverse events. And it's insensitive, and it basically, it erodes trust when we choose to write them off, when we choose to fail to acknowledge that they have legitimate issues. And so, though I believe vaccines are safe and effective, I think it's important if I'm going to serve the American population that all of those individuals are recognized, treated with compassion, and acknowledged.
Yeah, Dr. Schwartz, I just got a minute here, but I'd love to hear this. Secretary Kennedy and I, we share the same desire about nutrition. I think it's more and more important every day about nutrition in our country because what we eat is killing us, absolutely killing us. So what role are you going to be playing in the CDC with helping us have good food that's safe for us, that's safe for our kids? What's your role going to be?
Coach, if I can call you that, thank you for meeting with me earlier. I am all in on the Make America Healthy Again agenda. And as I look at what the Secretary has already done and the President has already done, they have introduced nutrition education in medical school. And I won't tell you when I graduated from medical school, but I can tell you we did not have nutrition education in medical schools at the time when I was in medical school. The Secretary is introducing physical fitness testing. In my generation, we did physical fitness testing, and this generation did not. He's removing those petroleum-based dyes and food products. So I am fully committed, if I am confirmed as a CDC director, to continue focusing on this Make America Healthy Again, because we're looking at those things that are happening to prevent diseases, and that's exactly what I've done my entire life as an occupational medicine physician. I'm all about looking at those upstream effects, looking at those things that we can prevent diseases and continue to make America healthy again.
Well, thank you. Work on nutrition, work on physical fitness, work on exercise, because this damn thing right here is killing our kids and killing everybody in this country because they're sitting around looking at it all day long. And if we don't do something about it, it's going to be our fault, not our kids' fault. Thank you.
Senator Kim.
Yeah, thank you, Chairman. Dr. Schwartz, I wanted to start with you. I was proud to be a career nonpartisan federal worker before in the civil service. I'm hearing from many across our government, but a lot at the CDC about low morale, especially after the big cuts last year. How are you going to try to address? How are you going to try to rebuild and give a sense of the trajectory of the CDC going forward?
Senator, thank you again for the question, and thank you for meeting with me earlier. When I think about trust, I always think about a particular instance in my career. I was the HIV program manager in the Coast Guard, and I had to tell a young Coast Guard.
I'm asking about specific to the CDC. What are you going to do in your first 10 days, first 20 days?
Senator, the reason why I was explaining this story is because this Coast Guard member needed to trust me. He needed to trust what I was telling him about his HIV diagnosis. And the one thing he had to understand is that I truly cared about him. And once he understood that, he was able to ask questions. He knew he could have a fulsome career in the Coast Guard. He knew he could have a fulsome life. And I take that experience to heart because that's exactly what I would bring if I'm confirmed as a CDC director. These career scientists, they have dedicated their lives to taking care of the American people. They have dedicated their lives working behind the scenes where they get no credit whatsoever to make sure they're protecting Americans from health, safety, and security threats.
Will you oppose future large-scale cuts to CDC personnel?
Senator, what I've heard through the news, I'm a private citizen here, is that the CDC is actually hiring more people to...
Well, I know that too, and I hope that to continue on, but would you oppose large-scale cuts if that was proposed again?
If I am confirmed as a CDC director, you have my commitment that I will work with the team at the CDC to understand what are those gaps, what are the things that are redundant, where are we having those inefficiencies to ensure that we have a CDC that can protect Americans from health, safety, and security threats.
Mr. Kaufman, I wanted to switch to you. I wanted to ask your thoughts about the Medical Reserve Corps that would be underneath ASPR.
Oh, I think they're absolutely essential.
The Medical Reserve Corps.
Yes, sir.
The thousands of volunteers all across the country, you think it's absolutely essential?
They're not only absolutely essential, they're the tip of the iceberg should this country ever experience not only a biological attack or a natural disaster or a chemical attack. They are very, very important.
Okay. Well, look, I'll just say I'm glad to hear you say that. The thing that kind of confuses me right now is that this has been zeroed out in the president's budget. When I was reading, set for elimination. What are you going to do about that?
Senator Kim, I'm hoping, I know that the president establishes the policy, but I believe the purse resides with Congress. And I'm hoping if you see the importance in this, and it is important, I'm hoping that you will make sure that those individuals are well-funded and resourced.
Well, will you commit then, if you're confirmed for this, to fight from the inside and work with us to see if we can continue on with this program?
Senator Kim, even with no budget, I will make sure those individuals get the best that we can give them with what we have.
Well, I'd prefer if it's not with no budget. I mean, the budget is not significant. I mean, I think this is something that we should be able to continue on.
Absolutely, Senator Kim.
Dr. Schwartz, just want to go back to you. You know, a huge part of CDC is about protecting America, especially when it comes to global health work. And I guess I just wanted to ask you your thoughts whether or not the withdrawal that the Trump administration set forward from the World Health Organization makes the American people more or less safe globally.
Senator, I think the World Health Organization does amazing things. But I also agree with President Trump that it was incredibly bureaucratic. And the Centers for Disease Control was doing the heavy lifting throughout the time that the World Health Organization.
So you think it's making us more safe to no longer be in the World Health Organization?
I think what's so brilliant is that the President and Secretary Rubio have something called the American First Global Health Strategy.
And that's better than being a part of the World Health Organization? It's not something that we could do an additive to membership there?
The American First Global Health Strategy, its purpose is to prevent diseases from coming to the homeland. And the Centers for Disease Control is working synergistically with that American First Global Health
So
Strategy.
you think we're better off now than we were a year and a half ago?
I think we are protecting the taxpayer
Not that hard of a question. Mr. Kaufman, I wanted to ask you, what's your thought here? Do you think we're more or less safe with the withdrawal from the World Health Organization?
Senator Kim, I think we are in the process of evaluating. You know, cuts sometimes, I think it's important to remember we are.
I always thought that you try to evaluate before you make cuts.
Well, we are 40 trillion in debt, and the president has asked us to scale back. And sometimes cuts don't necessarily mean poorer outcomes. It can actually lead to increased efficiency.
I just want to say, I don't discount the bureaucracy and reforms that are being needed, but shooting from the hip in that way, I mean, it's hurting our global reputation. It's hurting our ability to have forecasting in incredibly important times. With that, I'll yield back.
Senator Banks.
Dr. Schwartz, during the pandemic, the CDC revised its guidelines on mask wearing, social distancing, and quarantine over and over again. It was confusing and frustrating for all Americans. It was later revealed that the science never supported many of the CDC's leadership's statements or the guidelines that were put in place. What internal safeguards exist at the CDC to prevent misleading the public and ensure transparency?
Senator Banks, thank you for your letter. Thank you for meeting with me. I will actually frame that letter. It's very, very lovely. And thank you for the question. So if I am confirmed as a CDC director, I certainly want to make sure, as you heard in my priorities, that we are being radically transparent with the American people. And so the first order of business for me is to really do a listening session with the CDC career scientists. I want to make sure I understand what are their pain points? What are we doing as the CDC to help restore trust with the American public? Now, the one thing I think that is very concerning to me is that internally to the CDC, there is a breakdown in trust between the career scientists and the politicals. And I want to do everything that I can to make sure that I can, and the team that's already on the ground can help build morale within the CDC. So if we have the same North Star, protecting Americans from health, safety, and security threats domestically and internationally, the American public can feel safe and secure that we are going to be protecting them while they're sleeping, while they're not even thinking about public health, because internally within the CDC, we're one team, one fight, and we're protecting the American people from various threats.
I think it's really important after what we went through that the American people deserve better, and what happened was a total disaster, and they were lied to. On another question, another front, what can the CDC do to better support and work directly with the states rather than over-centralizing decisions at the CDC level, the federal level? How can you better work with states like Indiana?
So, Senator, thank you for the question. As you heard in my opening remarks, one of my priorities is to strengthen the relationship between the CDC and our state, tribal, local, and territorial partners. I do not want to have a CDC that is a rigid top-down CDC. I want to work with the CDC, with our state partners to understand what are the things that we can do better, what are the things that they need our help on, what are the things that they don't really need our help on. When I was the community-based testing site leader during COVID-19, one of the things I recognized was that there were three types of states. There were states that they needed just the idea, and then once they figured out how to do it, they said, thank you very much, government. There was another group of states that said, well, we just need like resources, personnel, and we're good. And then there's a third group of states that said, we need everything, don't ever go away, federal government. I would like for states to be more in that second and first category where they're learning how to take care of their citizenry and they're using the CDC only when they need to use the CDC. It's going to be a partnership, and you have my assurances that if I'm confirmed as a CDC director, I will continue working on that partnership.
I believe you on that. Does the CDC have any missions that you think are inappropriate or should be performed by another agency?
Senator, I am excited, if I'm confirmed, to understand what are I think I know what the core capabilities of the CDC are. I am a little bit biased. I focused on the original mission of the CDC back in 1946, focusing on protecting Americans from malaria. I do think that the CDC should have an infectious disease prevention focus. I think over time, the CDC has had some mission creep, and it's trying to be all things to all people, and in a resource-constrained environment, $40 trillion, nearly $40 trillion in debt, we need to refocus and figure out what should the CDC be. And I would love to work with Congress, with the Secretary, with the President to truly understand, should the core mission be protecting Americans from infectious diseases, or should we continue to try to be all things to all people?
Yeah, I hope we can get you on the job so you can quickly begin that process. Indiana is frequently hit by tornadoes and floods, especially in the summer. Many of our emergency management officials in state and local government are really frustrated with FEMA. The CDC also has similar emergency preparedness and response mission to FEMA. What is CDC's proper role in assisting states with natural disasters?
So Senator, I would absolutely say that we are taking the CDC should be taking a supporting role. Again, the CDC, in my opinion, should not be coming in, with our sharp elbows telling the states what to do, but the CDC should really be focusing on what does the state need us to do. And that's hopefully what I can continue to focus on if I'm confirmed as the CDC director.
Thank you. You have my full support, both of you. Look forward to working with you. I yield back.
Thank you.
Senator, is it also Brooks or LBR? Also Brooks, okay.
All right, thank you. It's good to see you again, Dr. Schwartz, and good to see you, Mr. Kaufman. And thank you both for your willingness to serve. In April of this year, Secretary Hegseth posted a video where he said, and I quote, "The notion that a flu vaccine must be mandatory for every service member everywhere in every circumstance at all times is just overly broad and not rational." So Dr. Schwartz, I want to ask you whether you agree with Secretary Hegseth. Is a flu vaccine mandate irrational and absurd?
Senator, thank you for meeting with me. As you know, I spent over 25 years in the uniformed services, and I have had my share of making the mandates for influenza and other vaccines, or at least following. I didn't make the mandate, but I followed leadership as they made the mandate for those vaccines, and I understood why. When you're in congregate living situations, when you're in submarines, when you're on ships, close quarters, it is really important to make sure that you have what we call force health protection. So I'm fully supportive of, in certain circumstances, mandating vaccines for military members, with the exception of, I believe in religious exemptions, and I believe that if there's a newer vaccine, there should be some conversation as to whether that newer vaccine should be mandatory.
Okay, so you do not believe that it's irrational and absurd to have a mandatory flu vaccine mandate in the military?
There are a lot of double negatives there, but I think that what you're asking me is, do I believe in vaccine mandates for military members? I do believe in certain circumstances, yes, there should be a requirement to have mandates in the military.
Okay. Now, he also said our men and women in uniform are forced to choose between their conscience and their country, even when those decisions pose no threat to our military readiness. And Dr. Schwartz, I know you've spent years overseeing healthcare delivery for Coast Guard personnel and led public health and medical readiness programs, and you've spoken about vaccines and how they were critical, as you did a moment ago, to responding to an outbreak. Well, you spoke about Cape May, the Coast Guard Training Center, and wonder whether you believe that an outbreak among our armed services pose a threat to our military readiness.
Senator, as you mentioned, the example that I gave was when I was in the Coast Guard, with the Coast Guard, Cape May, Coast Guard Training Center, Cape May, we were seeing increases in febrile respiratory illnesses, and it was due to adenovirus. And we were trying our best to have non-medical countermeasures, hand washing, social distancing, but nearly impossible when you have congregate living situations and you have recruits that are taping up the faucets because they want to maintain A+ for their inspections. In 2011, when the adenovirus vaccine did become available, we did make it mandatory to make sure that we could actually prevent these outbreaks and improve readiness and improve training. And I will tell you, within a couple of weeks of us instituting that mandatory vaccine, the adenovirus vaccine, we did not see any such cases of outbreaks post the implementation of the vaccine.
So those vaccine mandates can be effective and are important. Now, also, Dr. Schwartz, after your nomination, Secretary Kennedy's anti-vaccine ally, Aaron Siri, called you the queen of mandating vaccines during your time at the Coast Guard. And so what is your response to Aaron Siri and other anti-vaccine advocates criticizing you for supporting vaccine mandates?
Senator, I want to be the CDC director for all Americans. I don't want to be the CDC director just for Americans that believe in vaccines. I want to be the CDC director for Aaron Siri's and people that have concerns about vaccines. I approach this position with humility. I want to be a nation-centered CDC director. I want to make sure I understand why parents have vaccine hesitancy. As Sean mentioned, I don't want to ignore them. I don't want to dismiss them. I want to have an open conversation with them. I would love to have a conversation with Aaron Siri. I would love to understand his concerns about vaccines. I would love to have an open and transparent debate. And that's the kind of CDC director that I would like to be.
So it sounds like you're more polite and more reasonable than Aaron Siri, but I have one more question about vitamin K. It's an essential nutrient, as you know, which helps blood clot. And a single vitamin K shot is a highly effective intervention to prevent dangerous internal bleeding in newborns. Yet the vaccine misinformation and confusion that the Secretary has championed for years has now created a spillover effect that is increasingly causing parents to refuse the vitamin K shot and other routine care. In April of this year, Congresswoman Schreier, a pediatrician, asked the Secretary to directly confirm for worried parents that the vitamin K shot was safe, and he refused. Can you confirm for us today that the vitamin K shot is safe, and would you recommend that parents get the shots for their babies?
Senator, I can confirm that the vitamin K shot is safe. I do worry, like you, about conflation of vitamin K with other vaccines that parents may be concerned about. But vitamin K can absolutely reduce the hemorrhaging in children, newborns. I absolutely believe it is safe and it's effective, and I urge all parents to get the vitamin K shot.
Thank you.
Senator Hawley.
Thank you very much, Mr. Chairman. Thanks to the nominees for being here. Congratulations on your nominations. Dr. Schwartz, if I could just start with you. I want to ask you a question that I'm getting a lot now at home in the state of Missouri, and it's a question for which I don't have an answer because I'm not a doctor and I'm not a scientist, but we have a lot of data centers in the state of Missouri. More and more, 60, I think, right now in my state, many more coming online. Nationally, of course, I think there's something on the order of 4,000 with another 3,000 planned as soon as this coming year, maybe by the end of the calendar year. Here's my question to you. I get asked now pretty regularly, I would say constantly, about the health effects of living near a data center, which more and more people in my state do by virtue of their proliferation. Things like the effects of electromagnetic fields, neurological issues associated with the industrial drone, as it's called, constant noise. Now, I don't know the answers to any of this. And Secretary Kennedy and I were discussing it when he was sitting where you were just a month or two ago. His comment to me was, and I want to make sure I quote him accurately, he said to me, this is his quote, "The risks to me are horrendous. The risks to me are horrendous." And he said that HHS was going to study the issue. My question to you is, do you know, is the CDC currently doing any kind of study of the health effects of living near one of these massive industrial data centers? Do you know?
Senator Hawley, I don't know the answer to that question, but I do know that NIOSH, they do these health hazard evaluations. And so the answer to that question would be directed to NIOSH, which is under the CDC. So if I am confirmed as a CDC director, I would actually love to work with your staff to understand, has NIOSH done an HHE regarding data centers? They may have. I just don't know the answer to that.
Good. Well, you anticipate my next question, which is that if you are confirmed, and I believe you will be, I hope you will be, if you're confirmed, will you ensure that the CDC, in whatever subcomponent is appropriate, does a full-scale study of these health effects so that we can figure out what the answers are? Because I just don't know what to tell people. I mean, and I say that. I just don't know. I know that there's proliferating studies. A number of studies say that there are health concerns. Of course, industry says, oh, there's no health concerns. I don't know. But I think we should get the answers, particularly as more and more Americans, we're talking about millions of Americans, live near one of these data centers. They're very controversial, as you know. So will the CDC and its appropriate subcomponents under your leadership look into this and try to get the data, the actual evidence, as it relates to these health effects?
Senator, you have my commitment to work with your staff to find out exactly if an HHE has already been done by NIOSH. It could have already been done. So if it has been done, and if it hasn't been done, you have my commitment to work with your staff to understand why it hasn't been done and to find out if it can be done.
Good. Okay, good. I'm going to take that as a yes. That's I think that was a yes. I'm going to interpret it as such. Let me ask you about another piece of reporting. The CDC collects data on abortions that are committed in the United States of America through a system called the Abortion Reporting System. This system is voluntary, and so a number of states, not coincidentally large blue states, do not turn over any data, so that it's difficult to get a picture of just how many abortions and under what circumstances are committed in this country. We do know the numbers are going up, way up. Since the Dobbs decision of just a few years ago, the numbers of abortions committed in the United States have gone way up. Well over 1 million abortions last year. I'm sure the number, based on what we know so far, will be higher this year. And all of that is just based on what we can cobble together without full reporting. My question to you is, and I realize that the abortion reporting system There's been some talk of moving it to a different component in HHS other than CDC, but historically it's been located in what would be your agency. So if that continues to be the case, would you commit to trying to get as much information, again, to collect the data on the number and circumstances of abortions as is provided for in this system, to collect that data from these states and to work with those states that are currently holding out and not giving it to actually get the data so that we can know, we can get a picture of what really is going on here? Will you do that?
Senator, you have my commitment. Abortion surveillance is absolutely a critical component of what the CDC is currently doing. To your point, it may be moved to another agency within HHS. I also want, I agree, yes, I will look into that. But
Thank
I
you.
also want to also make sure that certain states are not conflating emergency services and hiding abortions in that emergency services case definition. We need to make sure we're pulling out true abortions and making sure that we're really having clear case definitions regarding abortion so the data is actually accurate.
Tremendous. Fantastic. I thank you for that, and I look forward to seeing you follow through. My time's almost expired, so I'll just flag. I want to give you a question for the record about another Missouri issue, and the Agency for Toxic Substances and Disease Registry, which is would be underneath your purview. Some years ago, this agency issued a report about a toxic landfill in my state and said that there were no health effects, no health concerns. I can just tell you, subsequent data shows that that was totally wrong. We have some of the highest cancer rates in the nation around this landfill where there is nuclear radiation and its components. I want to make sure that we get that science corrected and that we're getting the help and relief that the people of Missouri need. So I'll follow up with you on that. Thank you, Mr. Chairman.
Senator Hickenlooper, who snuck in just before Blunt Rochester would have started, you know? Yeah. Senator Blunt Rochester, then.
Thank you so much, Senator Hickenlooper. Thank you to the chairman and ranking member, to Dr. Swartz and to Mr. Kaufman. Thank you for being here, and to your families. Dr. Swartz, in the last 18 months, as we all know, the CDC has had a confirmed director for only 29 days. You are well qualified, but we've seen a lot of people who were qualified struggle to succeed in this administration. And I'd like to understand your thinking on several CDC, key CDC and administration actions just to help the committee gauge your judgment and independence. And we had a very good meeting in my office. And it's really important as well because it's my understanding while the administration put your name forward, this was not Secretary Kennedy's choice. So you're going to have to work with him in these efforts. And I want to follow up on Senator Alsobrook's questions about when you were Chief Medical Officer for the Coast Guard. We had a really good conversation about that as well. And just your success there, how you did mandate that the new military recruits receive the adenovirus vaccine in Cape May, and that this actually brought down the number of cases to zero. Am I correct? And I was really impressed by that. But I also know that in April, Secretary Hegseth, our Defense Secretary, rolled back the flu vaccine mandate that had been in place in the United States since World War II. And so I guess my first question is, it was widely reported that unsurprisingly, a major flu outbreak occurred at Lackland Air Force Base in Texas that prompted the Pentagon to then restore the flu vaccine requirements for new military recruits. So my question is, would you have advised Secretary Hegseth against the decision to roll back the flu vaccine mandate for American troops, particularly as we talk about readiness for our troops?
Senator, I really don't like speaking in hypotheticals, but what I will tell you is.
So let's not speak as a hypothetical. Let's say you are actually in line to be the next CDC director. So you're going to be thought of as a medical expert for this country. Would you advise that?
So, Senator, I believe, as a board-certified occupational medicine physician, I believe that vaccines are safe and effective. I have personally given thousands of vaccines to military members for force health protection and readiness. I do understand that there are some concerns, specifically about influenza, because it has the 35 to 57% effectiveness season to season. So I can understand why certain individuals may have some concerns about mandating a vaccine that
But
is
is it
not
good medicine?
I believe personally that influenza saves lives and vaccine saves lives. But I can understand why there are some concerns about mandating a vaccine that has, 35 to 57% effectiveness season to season.
I want to shift also to the measles outbreak. The CDC did not post a single message in 2025 encouraging people to get vaccinated for measles, even as we were in the midst of one of the biggest measles outbreaks in over 2 decades. The CDC also halted the wild to mild flu vaccine campaign and dramatically scaled back its back-to-school vaccine education efforts. Will you publicly urge Americans to get vaccinated?
Senator, absolutely. I am, as I said, I'm an occupational medicine physician. I have been vaccinating people throughout my entire 25-year-plus career in the uniformed services. I believe in vaccines, but I do also understand that there's a large swath of Americans who have some vaccine hesitancy concerns, and I want to be the CDC.
Would you reinstate the back-to-school vaccine campaign?
So, Senator, what I would like to do is make sure
It's
that
just a yes or no if you think you know the answer. If not, you can say you don't know yet.
I would actually like to talk to the CDC career scientists to understand what the current resources are to see if that.
I only have 14 seconds, and it says Senator Moody here. So I'm going to can I jump to my last question without questions for the record? In January, Dr. Oz, Dr. Bhattacharya, and Dr. McCary presented a memo to then acting CDC Director Jim O'Neill recommending the U.S. adopt a narrow childhood vaccine schedule based primarily on a comparison with Denmark. Do you agree with the memo's recommendation to no longer universally recommend all 17 vaccines?
Senator, I agree with the President of the United States who asked HHS to take a look at that said memo and to find out if those recommendations were sound, if they were not sound. So if I'm confirmed as a CDC director, you have my commitment to take a look at that said memo to understand whether comparing to Denmark makes sense or it doesn't make sense, whether the evidence suggests that those 6 vaccines, influenza, COVID, hepatitis A, hepatitis B, meningococcal, rotavirus,
Unfortunately, my time has expired, and I want to respect the committee. And I know that, Senator Cassidy, we have talked about this issue of vaccines for a while, particularly comparing ourselves to Denmark, which is ridiculous. And I will share with you, while I think you are immensely qualified, I am very, very concerned that even qualified people have either had to change their positions or quit. And so, again, I wish us all luck on our public health at this moment. And I yield back, Mr. Chairman.
Senator Moody.
Thank you, Mr. Chairman. Appreciate you being here today, stepping up for important jobs, and I guess putting yourselves through this process is no easy task. I'm sure the job will be hard, very hard. Maybe this is a good tryout for that. But we appreciate you being here. It's so important that we have great people in these roles. It's important that we have public health authorities that not only are prepared for disasters and pandemics, but can execute on their responsibilities in accordance with the Constitution, the first principle of government, to protect people's rights. And boy, did most every government official forget that when COVID hit, and especially under the last administration. Although, in Florida, we tried to make every decision and to promote the health, safety, welfare of people through the lens of how do we also protect people's rights. And I'm listening to some of the questioning today, and I think it's important that we talk about this, because if you'll remember, there was a time when folks wanted to shut people up in their homes, shut down churches, shut down schools, shut down businesses. In fact, they shut down the cruise industry for almost a year and a half before I came in, and we litigated and pushed back legally But they used the CDC. I think they used an old quarantine law from forever ago. You know, that's a big deal to a lot of people in Florida. 60% of the nation's cruises leave out of Florida. It affects a lot of jobs. And I think that there is this new almost political insanity, especially in this kind of party that seems to be taking over the Democratic Party. I mean, at one of their conventions, the Democratic Socialists, they call themselves, although they are an extreme authoritarian group, they want to control lives. They required masks, and this wasn't like during COVID, this was just recently, if you took a shot, masks, social distancing, which, by the way, when I was Attorney General, I led a grand jury investigation which said that that was created out of thin air with no basis in science. 6-foot rule, you had to have your COVID shot to go. Oh, and you had to have your booster shot within the last 12 months. This was just to attend the convention. This is a party that says they promote their policies and their mandates and extreme central government control over every facet of your lives, over individual autonomy. And that should scare every American. I don't care where you are on vaccines. I think that is a symbolic argument, and it is an important argument of, in the narrowest of circumstances, where you should force someone or have a mandate on someone. You know, Florida led the litigation charge against mandatory vaccines. They wanted to tell you what you put in your body. And yes, I think making someone choose service and country over autonomy and individual liberty, that is a discussion we need to have, and I hope you have good answers for that. But I ask you, do you believe it's the first principle of government? Government is set up and should be set up to effectuate protection of individual liberties first and foremost. Yes or no? Is that why our country was established? Dr. Schwartz.
Thank you, Senator Moody, and thank you for meeting with me, and thank you for representing the great state of Florida. I agree with that contention.
And do you believe in your service as CDC director that you are going to have to make important decisions regarding health, but at all times you will have to be mindful of individual liberty?
I absolutely agree with that contention, yes.
And I think what we are seeing now in terms of what the insanity on the other side of the aisle, in terms of the things that they want to mandate and cram down the throats of Americans and how much control of America they want, we have to be asking every nominee what they believe the purpose of government is. Because we are confronting now people that believe America should be something that it wasn't meant to be. And we have to have good, strong, bold, courageous leaders taking on these jobs that understand the evolution of this country, the success of the country, and what it was built on, and why it exists, and why we have been so successful. So thank you for taking on these roles. I do want to ask you really quick, Florida is home to more than 10,000 World Trade Center Health Program members. It's the largest population outside the New York metropolitan area. There's been no clinical center of excellence that exists in our state. As you know, your agency will oversee and administer the World Trade Center Health Program, which provides healthcare for 9/11 related conditions. Congress has previously encouraged the CDC to look at creating a center outside New York. They haven't done so. I think this needs attention. We have such a large population in Florida, thousands. I know it doesn't shock anyone, but a lot of people have moved to Florida from New York. Thousands of people. We could really be a site. I'd ask you to commit to examining that.
Yes, Senator, you have my commitment to look into that.
Okay, thank you so much.
Thank you.
This will be Senator Hickenlooper.
Thank you, Mr. Chair. Mr. Kaufman, as you know, last year the administration abruptly canceled 22 projects, rough justice about $500 million, in research on the mRNA platform to address disease. I've been led to believe that you supported the cancellation of the research funding.
That is correct, Senator.
And a few months ago, there was major news showing that mRNA, the platform of mRNA, could be a promising, perhaps transformational treatment pathway for patients with pancreatic cancer, which I'm sure, as you know, pancreatic cancer is probably one of the most deadly forms of cancer. Less than 13% of the people that get it survive 5 years. So if mRNA research like this is being canceled, how can we begin to make sure that such a promising pathway is being adequately investigated?
Senator, thank you so much for the question. mRNA platforms are extremely promising. In fact, we're going to need them. We're going to need them to deal with the threats that are coming tomorrow. NIH currently is doing hundreds of millions of dollars of research in mRNA platforms for cancer, just as you've discussed. The mRNA cancellations that occurred, those mRNA cancellations that occurred were for the development of new mRNA vaccines. And this is the issue, that this is the reason why I support that cancellation. I believe we have hundreds of millions of people that were vaccinated with the first ever mRNA platform, the COVID-19 vaccine. First ever. We have so much we can learn. How to improve it. Why did most people not have a problem? Why did some people have a problem?
Is that why we stopped the research? If we had so much to learn?
The research was development of using new viruses. The research, in my opinion, should be redirected to learn what worked well with the mRNA platform and what didn't, because it was the first interaction with human health.
So that implies we can't do two things at once.
Senator, I think it's about being efficient and fiscally responsible. Meaning, why would we invest in new vaccines that we could actually make better by simply asking questions of the population today? What worked well, what didn't?
When I hear those stories and I hear of the PhD students who are in the process of doing possibly life-saving research into things that could solve pancreatic cancer, all of a sudden that's to be stopped, because that's something that's looking forward to a future use, because we haven't sufficiently studied the past. I'm incredulous.
The studies you're referring to specific to pancreatic cancer, those have not been canceled. Those continue at NIH.
Well, how do you decide which ones are going to be canceled? As close as I could tell, you canceled 22 projects, which was the vast majority, if not almost every one at that time that was going on. So what's the determination of which one turns out to be most life-threatening, most transformational?
To use the mRNA platform in the way that it's designed to use, which gives us unbelievable flexibility, if we ever face a threat that comes out like COVID that's so novel, we're able to sequence it. We're able to then plug it into an mRNA platform and deliver it, meaning even though we may have slowed the research down in that arena right now, we still have the capability today, if we are hit with a novel threat, to plug and play like we did in Operation Warp Speed, which by the way was a phenomenal accomplishment of President Trump.
Phenomenal accomplishment, but my argument would be that it took us 300 days to get, needles in the arm. We got to get that. If we want to avoid shutting down global economies, we need to get that down to 100 days, and that's why what that research was largely to begin looking at. How do we have an array ready to go? So if we do get one of these, as everyone predicts, we will have another pandemic-related infection. I feel that we should be ready to go right then and get it. Our goal should be 100 days, not 300 days. Dr. Schwartz, let me ask you, in April 2025, nearly 90% of the staff at the National Institute for Occupational Safety and Health, or as they call it, NIOSH, 90% of the staff jobs were terminated in that Doge event. I guess you call it a Doge event. It's like an earthquake. This resulted in the NIOSH office in Denver completely shut down for a period of time. These positions have been reinstated, but as I understand it, not every staff member has returned to work. Some of them got other jobs, have gone into different places. You've spoken about your background in occupational safety and occupational health. I trust that you do understand the importance there. Right now, back in Colorado, a lot of people are battling wildfires. It's not just Colorado, but in Arizona and New Mexico, Utah, many of the western states. Our firefighters are on the front lines, and they're requiring on protective equipment to do their jobs. The NIOSH office in Denver, at that time, and I think it's still the national headquarters of the Wildland Firefighting Program, which is doing everything it can to protect those firefighters. When we need firefighters more than ever, why was the target this office and this, that part of the program, when it seems like that should be a priority?
Senator, it was great to meet you, and I just wanted to say for the record, I did listen to Wagon Wheel, great banjo playing, so thank you for the recommendation. Senator, I did not know about what you just described happening in Denver. You have my commitment, if I am confirmed as a CDC director, to look into that with your staff and with the folks at the CDC.
Great, appreciate that. Now I'll come back to Dr. well, I'll stick with you, I guess. I was going to come back to Mr. Kaufman, but I will stick with you and talk a little bit about ASIP. Am I out of time already?
You're way over time, brother.
Oh, I thought I still had 1:25 left. I thought you'd reset the 0. Anyway, thank you both. I appreciate you being here.
Thank you very much, Mr. Chairman. Thank you both for being here today and your patience through all of us today. Dr. Schwartz, I want to start with you. Do you think it is the role of the federal government to be tracking outbreaks like cyclosporiasis?
Senator, thank you for scheduling a meeting with me, and I hope to have a very productive conversation with you next week. I absolutely believe that one of the core missions of the Centers for Disease Control and Prevention is tracking outbreaks domestically and also internationally.
Well, I absolutely do think it is part of the critical role of it. And for everybody back home, and I think everybody's starting to realize that there is a parasite spreading today, likely through some fresh types of produce, and it's sending people to the hospital with which doctors are calling explosive diarrhea. And here's the thing. The CDC used to conduct surveillance on this very infection through a program called FoodNet. But in July of 25, thanks to Trump, CDC made reporting on that illness optional. Now we are here a year later, and we're already seeing over 7,000 confirmed or under investigation cases and over 100 hospitalizations with no single cause having yet been identified, and those numbers are growing every day. So Dr. Schwartz, you are a physician. You are a public health expert. Is there any scientific or medical justification for CDC having eliminated mandatory reporting of that parasite?
Senator, this is the first I've heard of that. Cyclospora, as you know, is a terrible, terrible disease. As you mentioned, watery, explosive diarrhea. It's something that you would not want anyone to experience.
So you were not aware that this was canceled a year ago?
Senator, I was not aware of that.
Okay, if you are confirmed, do you commit to reinstating the required reporting for cyclospora?
You have my commitment to work with your staff and work with the CDC scientists to understand what can be done, why did it stop, and what can we do moving forward.
Well, okay, it is the job of our public health agencies to catch outbreaks like this and to take action, and it's hard to do when you have removed the reporting requirement or fired expert staff or undermined trust in public health. So for the record, to me, RFK Jr. and Trump's war on the CDC is now landing people in the hospital. Outbreaks happen, but we shouldn't need thousands of people to get severely ill before we reinstate programs and systems that were haphazardly canceled. So I want you to follow up if and when you're confirmed. Now, I am a huge proponent for vaccine research, which is why I, too, as Senator Hickenlooper just asked you about, Mr. Kaufman, about the canceling the $500 million in mRNA vaccine research through BARDA, which is they prepare our country for any kind of future issues like we all know we've had now. And last August, they canceled that, and we know that the mRNA technology has grown tremendously and provides new opportunities for biomedical research. You said you agreed with the Secretary's decision to eliminate that. I am where Senator Hickenlooper is. I don't understand how you want more research, but canceling it is okay. And I just wanted to be on the record. You are fine with that being canceled.
Senator Murphy, I think it's the type of research.
Murray.
I'm sorry, Senator Murray. My apologies. Senator, I think it's the type of research that we're looking at. I do believe that going back and learning about what we can improve and why things worked well and why things didn't is absolutely critical research. But the research that was canceled was actually investing in new
Correct, so that we would be able to be ready for the next COVID. And I think for all Americans, we've lived through that. We don't want to live through it again. And I think we we really need that kind of research. But Dr. Schwartz, you're here too, so same question. Do you agree with the Secretary's decision to cancel mRNA research funding?
Senator, this is the first time I'm actually hearing about this. As a private citizen, I certainly was not following that. As we had discussed before, mRNA technology is safe and effective, and I definitely would like to know more about this topic.
Okay, I'd like to ask you about that again, but Mr. Kaufman, you have said we need more research on people who received the COVID-19 vaccine. Well, good news is that CDC was doing just that, but then in April, the CDC delayed and they ultimately blocked the release of a report that demonstrated that the COVID-19 vaccine was highly effective. And that study, which was eventually independently published in JAMA, showed a 50% decrease in hospitalization from that vaccine. And just for the record, this is important to me. This type of political interference is really deeply disturbing. It doesn't do anything to instill the trust that you have talked about, Dr. Schwartz, in this committee, in our public health agencies. So I know I am out of time. I see my chairman has been very patient with everybody. I just want to ask you, Dr. Schwartz, this is critical, and I know some of my colleagues have pointedly asked you this. If you are confirmed as CDC Director and Secretary Kennedy asks you to commit in advance to approving every recommendation that ACIP makes in the future, regardless of scientific evidence, will you do that?
Senator, the Secretary would never ask me to do that, and you have my commitment
This is not hypothetical. As you have heard, this happened with the previous Susan Manaras, who was in and fired and came back here and actually told us that she was outed because of her scientific integrity. So this is not hypothetical, it's a critical answer. So I'd like to know, will you, if you're confirmed, commit in advance to approving every recommendation that ACIP makes in the future, regardless of scientific evidence?
You have my commitment, Senator.
If the Secretary of Health and Education, Health asks you not to, will you defy him and follow the advice of ACIP?
I will follow the science wherever it leads, Senator. You have my commitment on that.
Thank you.
I will take the chairman's prerogative and ask a few follow-ups. Mr. Kaufman, we got to restore trust. You were running for office for school board. You said you hated the CDC. Boy, that's a good way to undermine trust. And I mean that, kind of tongue-in-cheek, but no, really. That undermines trust in CDC if you're running for office and telling people you hate the CDC. What do you comment on that, please?
Senator Cassidy, Chairman, thank you so much for the opportunity to address it. In fact, there have been many statements post and many statements pre where I have said that the CDC is America's treasure. And it is, and it remains that way. In fact, I've been working there since November, and I believe the staff of CDC are exceptional. When I was running for school board, I believed in three fundamentals that I want to bring to ASPR as well. I believe that they provide the best information, all of it, not incomplete, not just the good news, but also the bad news as well, everything. I believe that we empower people to make decisions. We don't make it for them. We empower people with that information to make decisions that are right for themselves and their families, and then we serve, no matter what decision is made, whether people chose to get vaccinated or not vaccinated, we serve them equally. We don't deprive them, we don't hurt them, we don't demonstrate a lack of compassion towards people's decisions surrounding public health and medical interventions. At the time that decision was made, it was in the height with the greatest amount of sensitivity during COVID-19. I have since made numerous statements about CDC where they remain the national treasure. And at that time, heightened sensitivity, I did not agree with what CDC leadership was doing. The CDC workforce has always been the most dedicated workforce I have ever seen, and I was
So let me move on. Thank you for that explanation. I am almost flummoxed that you would support more research on the development of mRNA-type vaccines. Now, you speak of the need to do research on the side effects, the adverse events, et cetera, but that would either be CDC or NIH doing that research. At ASPR, you're supposed to be, ASPR, not you, but ASPR, is supposed to be supporting advanced research and the development of pandemic vaccines, and the mRNA vaccine, as Dr. Schwartz just pointed out, is safe. effective. It is rapidly able to be adopted for a new biosecurity threat. If the Chinese fashion a designer vaccine and they release it upon the world, our biosecurity depends upon the ability to rapidly respond to it, and an mRNA vaccine is probably our most rapid way. You really don't want to do research on that, man?
Senator Cassidy, I would always love to promote research. We were talking about a decision.
No, but on this in particular, on mRNA vaccine as a future pandemic vaccine, which I consider just like a cornerstone of our biosecurity response. Doesn't mean we're going to use the vaccine, but to say we're not going to research it?
I get accused by my wife all the time of caring too much about the technical aspects, but I'm stuck on a technical aspect, and I hope you give me some time to explain that.
You got to be quick though, because
I apologize.
I got to go vote.
If there is ever anything that's new, Senator Cassidy, that comes out that's novel, the mRNA platform is there, and it will be used the way it's been used in the past. The current research that was being proposed was taking existing strains of things we know about, and rather than using tested and proven vaccine platforms like viral vectors and traditional platforms.
Let me stop you there.
Yes, sir.
During the COVID outbreak, it was the traditional viral vector that caused the thromboembolic disease. The mRNA was safer than the traditional viral vector. Now, do we not do more research on the traditional viral vector type vaccine because no, it had thromboembolic disease and people were dying of strokes, et cetera?
Senator Cassidy, if I am confirmed, I will care tremendously about patient outcomes.
I stopped though. The question here is, I'm just again flabbergasted that you would support stopping research on mRNA vaccines because there were some adverse events. I mean, there's an adverse event from the Aleve I took this morning for my bad knee.
Yeah.
But that doesn't mean that we don't do continued research in nonsteroidal anti-inflammatory drugs, and it doesn't mean that I don't continue to take them. Because the risk-benefit ratio clearly favors the benefit. There's been multiple studies of research since the COVID pandemic showing the risk-benefit ratio, for example, for pregnant women, favors taking the immunization. So I'll go back to, how do you defend not doing research on mRNA vaccines going forward?
Well, moving forward, I would love to do more research on mRNA vaccines. If we're looking at—
But I'm talking about as to develop another vaccine, because CDC and NIH are the ones that do the type of research you were describing, the kind of retrospective, okay, let's do a longitudinal follow-up. This is again, directly in your bailiwick.
It is, absolutely.
You would be responsible for, yes, I approve this or I don't approve this. And the fact that you're casting doubt upon it, obviously is concerning.
I'm sorry, Senator Kent. I don't believe I am casting doubt. I want research. I want a better mRNA platform. But I believe before we proceed, we owe it to those who had issues, not just to those who benefited and did okay. We owe it to everyone to explore how we can make the mRNA platform more viable.
But how do you do that without doing the research? I mean, that's the whole point of research, to determine how to do that more safely.
The COVID-19 mRNA vaccine was the only mRNA platform in human health ever used. It was the first time it was ever used. I think we should be asking
there
questions.
were circumstances surrounding that. Let me go on. You had mentioned in some place a deleted LinkedIn post about an association in your mind between the birth hepatitis B dose and the increased onset of various things, and then saying that in the countries that had a birth dose, they had the highest rates of hepatitis B. Of course, that was misleading. The reason they started the birth dose is because they had a high rate of hepatitis B being passed from mother to baby. And if you look at the age at which they begin to have hepatitis B immunization at birth, there was no hepatitis B after that. It was the kids who weren't, it was the people who were not vaccinated both that had the burden of disease. So your LinkedIn post was either uninformed or deliberately misleading. But when Murkowski speaks about Alaska, they had endemic hepatitis B in the Alaskan Native population, and it's only with the birth dose that went away. Now, again, if we're talking about restoring trust and either misinformation or, I don't know what you were thinking, why would you repeat those damn lies? Because that destroys trust. And we don't start getting back to where we trust unless people speak the truth. I'm sorry to be kind of worked up about this, but I've seen people die from these vaccine-preventable diseases, including hepatitis B, and you're going to be one of the leaders in our response. I can respond to that, please.
Senator Cassidy, for 30 years in public health, whether I've been at a university teaching in classes, or I was in Trenton, New Jersey with the postal employees post-anthrax exposure, I have promoted vaccines as a public
But I'm
health.
speaking specifically about that LinkedIn post.
The LinkedIn post that was pulled down for multiple reasons. I'm a Gen Xer. My social media skills are not as good as everyone is today, but I saw that it was decisive, that it was actually dividing people, Senator. And I didn't want to divide people as a result of that post. But that post did have a critical aspect. Within that post, Senator Cassidy, I did say that I've always believed that vaccines are the gold standard of public health. Within that same post, and that post that individuals have misrepresented and mischaracterized, that I had tied the infant dose to autism, that's a mischaracterization. I have simply said public health owes it to the people to take a look at why there's been such an increase in autism and allergies. And even though I mentioned it in the same article, I never tied it directly to the infant dose of hepatitis B.
So putting it in the same article, of course, makes a connection. And the critical thing is, and I ask this not to be anything but trying to illuminate. Do you understand the difference between causation and association?
100%, Senator.
So just because there is an increase of something when something begins to get done. I once vaccinated a young lady for hepatitis B. She subsequently got pregnant. There's no biological way in which the immunization caused her pregnancy. That's pretty well established how she got pregnant. And so to establish an association and to imply, because it's in the same article, and I think it would be disingenuous to suggest it wasn't an attempt to imply, the United States began recommending hepatitis B immunizations for infants in '91. Can you guess at which age most children are diagnosed with autism? 5 years old. If you add 5 years to 1991, you'll notice a sharp increase in autism rates around that time. Now, that looks like it's trying to establish a connection.
Senator Cassidy, I again believe in vaccines. I believe in the infant dose of hepatitis B. My children are vaccinated. I believe hepatitis B. I believe vaccines have eradicated smallpox and changed the face of polio. And Senator Cassidy, I know what I've wrote. I know what I did. I believe that autism and allergies in this country have significantly increased. I believe we owe it to the general public to explore and identify why. Vaccines are safe and effective and do not have.
So if you're elected, if you're approved of this job, would you advocate for, changing back to our previous topic, research for the use of the mRNA platform to develop, to see its potential, not to foreordain a conclusion, but to see its potential in fighting future respiratory viruses or any other type of illness for which it could be potentially applied?
Senator Cassidy, if I am confirmed, I will fight for the very best mRNA platform vaccine strategy for all Americans should we face.
That's not the same answer.
I will fight for research, Senator Cassidy, sorry.
Dr. Schwartz, one last question, then we'll wrap it up. And thank you both for your patience. I have a sense that you were way over-prepped for this, because in our conversation, we spoke as two doctors. And here I spoke as, I felt like you were always trying not to answer my question, which was disappointing. So if you don't know that Kennedy asked Menares to approve blanket ACIP recommendations, then they didn't prep you on that, because that's public knowledge. Now, he may dispute it, but that's public knowledge. And to claim that's a theoretical does a disservice to you. It really is. And I'm here personally liking you, but feeling as if I'm having to represent the public health of the United States of America, so that it's not taken over by people who are ideologically inclined and looking to file a lawsuit, not looking to prevent disease. So have you ever fired someone before?
I have, Chairman.
And have you stood up to a senior, to someone in charge of you, and told them that you were wrong, that they were wrong, and that you would not carry out that order?
It's a very specific example. Coast Guard wanted to transition from a paper health record system to an electronic health record system. My leadership asked me specifically what my recommendations were. It made sense to go with DoD. DoD was having a huge modernization with their EHR. Not only that, it would save the Coast Guard tremendous amounts of money. Not only that, we would be part of a broader ecosystem. Our beneficiaries, Coast Guard beneficiaries, and our active duty members were using the DoD MTF ecosystem. I made that recommendation very clear to my leadership. My leadership said, thank you for your recommendation, and said, we're going to go ahead and build our own instance of an EHR. Several years later, $60 million taxpayer dollars later, they still did not have their own instance of an EHR. They looked to me and said, Doc Schwartz, what was it that you recommended again? And I said, we should be going with the DoD EHR. I said many but sirs and but ma'ams throughout that 5-year, 6-year period as they were trying to create their own instance of an EHR. I was ignored. Guess what? To this day, the Coast Guard is using the DoD EHR per my recommendation. But there was a period of time where my recommendations were not listened to. I respected the chain of command. I disagreed in private, but I certainly have had many instances where, like that, where my recommendations were ignored by the policymakers.
It's a little bit of a different scenario than what I gave you. If you're presented with the absurdity to believe that the demographics of the United States are similar to those of Denmark, and therefore we should adopt Denmark's type of recommendations, versus the knowledge that in the United States our demographics are quite different, would you just carry out the order? Because you'll be at the place where the rubber hits the road. And this is not a theoretical, because we hear this coming down. But anyone that knows an iota of our demographics knows we are not Denmark.
Chairman, you are a physician, I'm a physician, and you know exactly when you've had a question about something, some issue, whether it was something with hepatology, you didn't just look at American-based studies. You looked at some studies that were in other countries. You yourself made the assessment that, hey, listen, we are different. The demographics are different. My recommendation is not that we go with the Denmark study. What I was trying to say was the president asked the secretary, take a look, do a double click. Maybe there's nothing there. Maybe there's something there.
Of course, that's not my question. My question is, if a recommendation was made to implement a system which is not appropriate for the U.S. demographics. One example, Alaskan natives have a high incidence of mother-to-baby transmission of hepatitis B. Denmark doesn't have that. We are different than Denmark. And so if they said in Denmark they don't do it, we're not going to do it. What do you think? I mean, it couldn't just be, I'm going to take the order and execute it even if I disagree. It has to be something firmer. Stop. No. Time out. This is wrong. Dr. Menarez did that. And I think she will go down in history with great credit, even though I suspect she's being harassed. But that's the courage it takes to lead the CDC. So my question to you in that situation, would you just accept ACIP recommendations even if they were attempting to adopt a system not appropriate for our country?
Chairman, I would never, ever accept ACIP recommendations without doing a deep dive into what those recommendations are or were. I would work with these career scientists at the CDC. I would work with Dr. Jennifer Schufert, who's the chief medical officer at the CDC. We would look at the evidence. Where are they getting the evidence? Are these randomized controlled trials? Are these cohort studies? Are these test negative design studies? We would make sure we understood the weight of the evidence that they use to make those recommendations. And if the weight of the evidence isn't there, or if the science is questionable, you have my commitment that I would not at all ever agree to those recommendations.
Thank you. Do we have my script? Thank you again for both being here. It's been a long meeting, so thank you. For members wishing to ask questions for the record, those are due 5 p.m. tomorrow, July 16th. We stand adjourned.